Necrosis is defined as localized area of death of tissue followed later by degradation of that tissue by hydrolytic enzyme liberated by dead cell. Necrosis can be caused by various factors such as hypoxia, chemical agent, physical agent, microbial agent, immunological injury, etc. On the basis of etiology, morphology, appearance, the type of necrosis include coagulative necrosis, liquefactive necrosis, caseous necrosis, fat necrosis, fibrinoid necrosis. Coagulative necrosis. It is the most common type of necrosis caused by irreversible focal injury. Mostly it is caused due to sudden cessation of blood flow, ischemia or infraction. It is commonly seen in heart, kidney, adrenal gland, etc. Cause lack of oxygen, hypoxia, cause cell death is a localized area of the body where the blood vessel fail to deliver. Pathogenesis. It is microscopic appearance of coagulative necrosis. It is pale segmented of tissue certain against the surrounding healthy tissue. When progresses, the affected area become yellowish, softer and shrunken. It appears dry on the cut surface. The hallmark of coagulative necrosis is the conversion of normal cell into their tombstone appearance. In this, the outline of the cell are retained so that the cell type can still be recognized, but the cytoplasmic and nuclear hierarchy are lost. Liquefactive necrosis is also commonly occur due to ischemic necrosis, bacterial and fungal infection, but hypoxia enzyme, which is the tissue degradation, have dominant role in this type of necrosis, and it is semi-fluid material. Usually the dead leukocyte remain an creamy yellowish pus. After removal of the cell debris, a fluid-filled space left. It is commonly seen in brain, infect and abscess cavity. Pathogenesis. If the affected area is soft with liquefactive, certain containing necrotic debris, later on the cyst wall is formed. Microscopically, the cystic space remain macrophages and the necrotic cell debris. The cyst wall is formed by the proliferative capillary and inflammatory cell. Due to hypoxia death of cell within the CNS, it is lead to liquefactive necrosis. It can also occur in lung when the lung abscess is involved. Caseous necrosis. The word caseous means cheese-like. The type of necrosis is mainly formed in the foci of tubercle infection. The combined and feature of coagulative as well as liquefactive necrosis. The necrotic tissue appear as a soft and white dead cell mass. Etiology. The most commonly seen in Mycobacterium tuberculosis infection. It can also be caused by syphilis and some fungi. Pathogenesis. This usually begins as the infection, which is recognized by the immune mechanism of. Further, the macrophage begin the fight the infective microorganism and pathogenesis. During the macrophage, release chemical which chase the affected cell and cells begin to die. As the affected area die, they disintegrate but are not completely digested. The debris this disintegrate cell clump together and create soft granular mass giving the appearance of the cheese. As the cell death begins, the granuloma form. The cell death continues further by the inflammatory response mediated type 4 hypersensitivity reaction. Microscopic appearance. The caseous necrosis usually to histological architecture is preserved. On microscopic examination with H&E staining, it is characterized by acellular pin area and necrosis surrounded by granulomatous inflammatory cell. Center of the necrosis focus contains structure less eosinophilic material having debris, the disintegrate nuclei, usually the lung. This tissue disintegrate gets so excited. This may show area of cavitator which are also known as cystic spaces. Fat necrosis. It is special form of cell death occurring mainly at the fat-rich atomic location in the body. Grossly the fat necrosis appear the yellowish white and firm deposit. Formation of the calcium soap give the necros foci firm and scaly appearance. In the necrosis, fat cells have cloudy appearance and surrounded by inflammation cells. Traumatic necrosis of breast, mesenteric fat necrosis in adult pancreatitis. Fibroadenoid necrosis. It is specific pattern of irreversible, uncontrolled cell death. It mainly occurs the antigen-antibody complex are deposited in the wall of the blood vessel around the membrane. It is commonly seen in immune-mediated vascular inflammation, which is called result of type 3 hypersensitivity. Eosinophilic hyaline-like deposition in the vessel wall. It is seen in various ages of immunological tissue injury. Autoimmune disease. Author's reaction. In systemic lupus erythematosus, SLE, the dermis is often affected by the fluid accumulation and inflammation around the small vessel in the skin, which may show appearance of fibrinoid necrosis.